Good morning, my friend. Let me ask you something. When you wake up and try to swing your legs out of bed, do your knees feel like they're full of rust, stiff, tight, maybe even a little painful, like you have to warm them up before you can really stand on them? Maybe you sit on the edge of the bed for a minute or two, just waiting for that stiffness to ease off before you dare to put your full weight down. If that sounds familiar, I want you to know you are not alone, and this is incredibly common after 70. But here's the good news. It doesn't have to be this way every single morning. In this video, I'm going to show you 3 simple exercises you can do right in bed before your feet ever touch the floor that will help wake up your knee joints the right way, so you can stand up and walk those first steps without that awful stiffness or pain. I'm Dr. Alan Mandell, and welcome to Healthy Aging America, where we help you stay active, mobile, and pain-free as you age, one simple step at a time. If you're new here, consider subscribing, because we put out videos just like this every week. Now, let's get into it. So why exactly do your knees feel so stiff in the morning, especially once you're past 70? Let me break it down for you in a simple way. Inside your knee joint, there's a fluid called synovial fluid. Think of it like the oil in a car engine. It lubricates the joint and allows the bones and cartilage to glide smoothly against each other. But here's the thing. When you lie still for 7 or 8 hours overnight, that fluid isn't being circulated. It sort of settles, and the joint becomes dry and less lubricated. That's a big part of why things feel stiff first thing in the morning. On top of that, your cartilage, the cushioning tissue inside the joint, actually loses some of its water content overnight too, especially if you already have some wear and tear from arthritis. And the muscles around your knee, your quadriceps in front, your hamstrings in back, your calf muscles, they also tighten up after hours of being still. Add to that the simple fact that your blood circulation slows down significantly during sleep, and you've got the perfect recipe for that morning, rusty hinge feeling. Now here's a mistake I see so many people make, and I understand why. Because you're in a hurry to get your day started. You wake up and you just throw your legs over the side of the bed and stand straight up. But think about what that does. You're putting your full body weight suddenly onto a joint that hasn't been lubricated yet, onto muscles that are still tight and cold. That sudden load is exactly what triggers that sharp stiffness or even pain you feel in those first few steps. So what's the solution? It's simple. We need to gently wake up that joint, get some movement and blood flow going before you ever stand up and put weight on it. That's exactly what these 3 exercises are designed to do, and the best part is you do them lying right there in bed in just a few minutes. Before we get into the exercises, let me give you a few important safety reminders, because doing these correctly matters just as much as doing them at all. Number 1, move slowly and with control. We are not trying to force anything or bounce. Slow and steady wins here. Number 2, pay attention to the difference between a gentle stretching sensation and sharp pain. A mild pulling feeling is normal and okay, but if you feel a sharp stabbing pain, stop that exercise immediately. Number 3, breathe normally throughout. Don't hold your breath. In fact, breathing out slowly during the stretch can actually help your muscles relax more. And finally, if you've had a knee replacement, you have significant arthritis, or you're dealing with any acute injury or swelling, Please check with your doctor or physical therapist before starting any new exercise routine, including this one. This video is meant to be educational, not a replacement for personalized medical advice. All right, with that said, let's get into exercise number 1. The first exercise is all about gently kickstarting your circulation and easing your knee joint into motion, and it's the gentlest one we'll do, so it's the perfect place to start. Here's how to do it. Lie on your back in bed, legs straight out in front of you. Now, start with your ankles. Slowly point your toes away from you, then pull your toes back up toward your shins. Do this nice and slow, like you're pumping your ankles. This simple motion actually helps push blood up through your lower legs toward your heart, which helps wake up circulation in that whole area, including around your knees. Do about 10 to 15 of these ankle pumps. Next, we move into the gentle knee glide. Keep lying on your back. Now, slowly bend one knee, sliding your heel up toward your buttocks, keeping your heel in contact with the bed the entire time, like your heel is skating along the sheet. Bring it up as far as comfortable without forcing it, and then slide it slowly back down to straight. This is sometimes called a heel slide, and it gently moves the knee joint through its range of motion, helping that synovial fluid start circulating again. Do this slide about 8 to 10 times on one leg, breathing steadily, then switch to the other leg and repeat. A common mistake here is rushing through it. Remember, we're not exercising hard, we're waking the joint up gently. Take your time. Another mistake is lifting the heel off the bed and trying to do a full leg raise. That's not what we want here. Keep that heel sliding along the surface. For those of you over 70 dealing with morning stiffness, this simple combination of ankle pumps and heel slides is often enough, just on its own, to noticeably reduce that rusty feeling before you even get to exercise 2. Now that we've gotten some circulation going, exercise number 2 focuses on gently stretching the muscles around the knee, particularly the hamstring and the muscles at the back of the knee, which tend to tighten significantly overnight. Here's how it works. Still lying on your back, bend one knee and bring it up toward your chest. Use both hands to gently clasp around your knee or just below it, and gently pull it a little closer toward your chest. You should feel a gentle stretch in the back of your thigh and around your knee, not pain, just a comfortable pulling sensation. Hold this gentle stretch for about 15 to 20 seconds, breathing slowly. Then gently release and lower the leg back down. Switch to the other side and repeat. Now, if you find it difficult to reach your knee with your hands, maybe due to shoulder issues or just flexibility, here's a simple modification. Take a bath towel or a long scarf, loop it around the back of your thigh or your foot, and use the towel to gently guide your knee towards your chest instead of your hands. This works just as well and takes the strain off your shoulders and lower back. Do this stretch 2 to 3 times on each leg, always paying attention to how it feels. Remember, gentle pulling, good. Sharp pain, stop. This stretch is particularly helpful because tight hamstrings and tight tissue behind the knee are a huge contributor to that stiff, locked-up feeling so many of you describe when you first try to bend or straighten your knee in the morning. Our third and final exercise focuses on activating the muscles that actually support and stabilize your knee joint, your quadriceps in the front of your thigh, and your gluteal muscles. Strengthening and activating these muscles, even gently, helps your knee handle weight much better once you do stand up. Here's the first option, the gentle bridge. Lying on your back, bend both knees with your feet flat on the bed, about hip width apart. Slowly press your feet into the bed and lift your hips up just a few inches, squeezing your glutes as you do. Hold for 2 to 3 seconds at the top, then slowly lower back down. Repeat this 8 to 10 times. If a bridge feels like too much, here's an easier alternative, the seated leg extension, which you can even do sitting up against your pillows. With your legs straight out in front of you on the bed, simply tighten your thigh muscle, pressing the back of your knee down into the mattress. Hold for 3 to 5 seconds, then relax. Repeat 10 times on each leg. Both of these movements gently activate the muscles around your knee, which is incredibly important because strong, active muscles around the joint act like a natural support system, taking some of the pressure off the joint itself when you finally do stand up and start walking. Now, here's a step that I think gets overlooked far too often. How you actually get out of bed after doing these exercises matters just as much as the exercises themselves. Once you've finished all 3 exercises, don't just sit up and jump to your feet. Instead, slowly roll onto your side first. Then use your arms to push yourself up into a seated position on the edge of the bed. Sit there for just a few seconds, letting your feet settle on the floor. Next, place both hands on a sturdy surface, the edge of the bed, a nightstand, or even your knees, and slowly push yourself up into standing, keeping your movements controlled, not rushed. Once you're standing, just pause for a few seconds before taking your first steps. Let your body adjust. Then take those first few steps slowly and deliberately. You'll likely notice a real difference. Your knees should feel looser, more ready to move, instead of that sudden jolt of stiffness you might be used to. Now, I want to be honest with you. Doing these exercises once isn't going to be a magic fix. But here's what I see time and time again with people who make this a consistent morning habit. Over time, with daily practice, many people notice their morning stiffness gradually becomes less intense and doesn't last as long. Walking that first stretch from the bedroom to the kitchen becomes more comfortable, and because you're keeping those muscles around your knee active and engaged, you're also helping protect against falls, which, let's be honest, becomes a much bigger concern as we get older. Beyond just the physical benefit, there's something powerful about starting your day feeling capable instead of starting it feeling defeated by pain. That sense of independence, being able to move through your morning routine without dreading those first steps, that's really what we're working toward here. A few extra tips before we wrap up. If your knees feel especially stiff, you might find it helpful to place a warm compress or heating pad on your knees for 5 to 10 minutes before doing these exercises. Warmth can help relax the muscles and improve blood flow even further. Staying well hydrated throughout the day also plays a bigger role in joint health than most people realize, since your cartilage and synovial fluid both rely on proper hydration. And beyond this morning routine, try to incorporate some gentle movement throughout your day, even short walks, rather than sitting for long stretches, which can cause that stiffness to creep back in. One more important note. If you're experiencing knee pain that's severe, persistent, or comes along with swelling, redness, or warmth around the joint, please don't just rely on home exercises. That combination of symptoms needs to be evaluated by your doctor, as it could indicate something that needs more direct medical attention. So let's quickly recap the 3 exercises we covered today. First, ankle pumps and gentle knee glides to get circulation moving. Second, the knee to chest stretch to loosen up tight hamstrings and the back of the knee. And third, gentle bridges or leg extensions to activate the muscles that support your knee joint. Try incorporating these into your morning routine, right there in bed, before you ever put your feet on the floor, and give it some time and consistency. Your knees and your mornings may genuinely start to feel different. If this video helped you, please give it a thumbs up and subscribe to Healthy Aging America so you don't miss our future videos on staying mobile, active, and pain-free as you age. And I'd love to hear from you. Leave a comment below and let me know how your knees feel after trying these exercises for a week. Take care of yourself, move a little every day, and I'll see you in the next video.